And welcome back to One Day Through Wayne's World on WRPBTCV and Treasure Coast Video. And you know, I gotta tell you, we're learning so much about businesses on the Treasure Coast. And with me, and she makes me look good. I call her Patty, and it's Patty Cox, or doctor.
Sure.
Because you're a doctor.
It's true.
Okay. So how lucky am I to deal with doctors and ones that look better than me? Okay, let's talk about your business.
All right.
Okay. You're on the Treasure Coast. Where are you located? Let's tell people where you're located. How they can find you.
We're on St. James Drive.
Okay.
So it's the more northeast portion of Port St. Lucie, which is really big. So loaded question there.
Isn't it like kind of off like Arosa?
Yeah, you go. Yep. It's right off Arosa.
So you go to Arosa. There's a light there. You make the right, and you go down, and they're on the left-hand side. How long have you been doing business up here?
On our own?
Mm-hmm.
So we've been in there since June of 2016.
Okay.
So,
and it was another practice. So
yes.
Okay, and did you work for that doctor?
No, we worked for separate doctors for a while, but we got it from Dr. Michael Hofste, who retired.
And if you heard the word "we," it's because that house is not only one doctor house; it's a 2-doctor house and like 400 kid house. How many children do you have?
4.
And she has 4 kids, and she's in better shape than me, and I've had no kids. Okay, all right, but you love kids, so that's great. I think
and we love adjusting kids. We love having kids as patients.
And I understand that. So, why the Treasure Coast? Why up here?
Okay, well, I'm from Miami originally, and I didn't want to go that far down south. We really liked where we used to live up in Volusia County, which was a great place where we went to school, but there's just no jobs there for chiropractic. It's completely saturated. And my husband's from Sebring, and my dad is the most permanent of our family that doesn't move around. He's in Boynton, so we wanted to be driving distance from everybody, but kind of on our own as well, which I'm kind of regretting now. I don't have my parents closer, but I love this area, and we thought it was the perfect area. Originally, we were looking at Jupiter, and we moved here just to have a place initially, and we were going to commute to Jupiter, and we ended up saying, you know what, we like it here. What if we just stay here? And it seemed to be very good with family, very good with schools, and we just fell in love with this area.
When we talk about the kids, did you take schools into effect when you were looking to buy your house? Yes,
we actually built our house in the neighborhood of Morningside Elementary, because we've heard such good things about that school specifically, and that's where my oldest goes and loves it, and she's in the gifted program there, and it's just a wonderful school. We're very thankful that we have that school.
All right, so we're on the Treasure Coast. Yep. What's the business climate? I mean, like, is it busy up here? Is it seasonal up here? How do you feel when it comes to that?
I feel like I'm learning more and more about that every day. Okay. But I don't really have much to compare it to, but I do know we have a high snowbird season. Okay. And, we definitely see an influx of patients during that time of year, just like we do with the traffic. So, but that's great because, we communicate with people's chiropractors up there because, they're here for a lot of the year. Right. And so we'll work with them, the chiropractors up there to make sure they're maintaining a specific type of care or whatever and that they're doing okay. We'll call and check up on them. We have some that come all the way from Canada down here. We have a big Canadian population down this way. Yeah, it's surprising, actually.
Yeah, and even on the west coast of Florida, a lot. What about, what would you consider the sweet spot for you? Who's your clientele, your best clientele? And I know you like the children, because that's you. But, I mean, who's your clientele? Is it elders, middle-aged, old, and old as dirt like me? Or,
That's tricky. I'm thinking about what my husband would say right now, and he loves Medicare patients. Okay. They're very compliant, and they have an issue that the sweet spot, I guess, would be obviously before they require surgery of any kind, right? So if somebody is in mild discomfort, and they're looking to, want to completely change things for themselves. And that's a sweet spot for us because there's not so much accelerated degeneration that we can't make a big impact on what the future is going to be for them. And so I love when we get somebody that's like middle-aged, that's never been to chiropractic before, because we know that we're able to change so much for them if they follow the right treatment plans and such. So,
My mom's 87. She got her mind about her, but she has a hard time walking. It's painful.
Yeah.
Is there like treatments for someone like her?
Well, we'd have to see X-rays,
Right.
MRIs.
You X-ray on their facility.
Yes, we have an X-ray machine in our facility. Yes, we do. We can X-ray whatever part of you like or need or complaining about. We just did a patient's foot and whatnot. But if someone's having trouble walking, of course, we'd have to do a lot of detective work to see what is the pain generator, what's limiting her. There's so much there. It could be her hips, it could be her feet, it could be a nerve, it could be a disc. But certainly getting into chiropractic, of course, we're trying to correct the problem and not just, if she's having trouble walking in the normal world, it's say, here's a walker. Here's a little prop or a medication to mask your symptom or help your problem. We would like to find out why is that, of course.
Okay, and that makes sense. I do your marketing, or I'm starting to do your marketing. Prior to me, what kind of marketing did you do? Did you do newspaper, radio, or did you get in there and you already had a clientele, I guess, because he had a clientele?
A little bit.
Okay. It was hard. He was ready to retire, so he didn't push himself.
And he liked it at that size. Some people love, seeing 700 patients a week. We like seeing an amount where we can give our patients the time and attention that they deserve. But so our marketing approach before was, honestly, it's like you graduate, here you are, you learn all these skills and how to take care of people, and then it's like kick you out the door, good luck. They don't teach you barely anything about this stuff in school, and so it's a trial and error, learn life the hard way.
And you got stuck with me.
Just figure it out. So that's pretty much.
But you know what?
We've tried different things.
Right. But the thing is always, and we talk about it all the time, go with the professional. That's who gives you the, this is what I do. You can't come to me and I won't adjust your back. Okay, that's just not the things I do. What makes you unique and special? Now I know that you have X-ray on premise.
Right.
The tables you use, the equipment you use, what makes it special, or what's different about it?
Okay, well, this is top secret.
Okay.
Are you ready?
I'm ready. You guys can listen. No listening to you. Just tell me. Okay.
Dr. Clifton, my other half, he is inventing, if you will, his own cervical traction contraption. So seriously, he's made his own. It's in the process of being completely done up in the room. I would say that's definitely one of our special services is our heart really is in prevention of all disease and discomfort, right? I mean, that's the heart of chiropractic, but specifically what we're focusing on is called corrective care, where you're making structural changes, right, with the curves. Spine's supposed to have 4 curves, right? But they're supposed to be in a frame of a normal range, right, of those curves. So a lot of people, very common, have scoliosis, whatever. So this corrective care approach that a lot of chiropractors utilize, I don't know how many are here in this area, but it takes a little bit of extra time, so not a lot of people do it. But we use certain tools. We have one called the ArthroStim. It's where we're correcting your curve. It's kind of hard to explain in just a short amount of time.
First of all, I'm not a doctor, so she's seeing things, and I'm not sure, but I'll Google it later.
Well, we take a special series of X-rays,
right,
and we study them very carefully. Each segment, how it moves. It's not just showing you, okay, you have a disc herniation here, you have this here. It's a little more complicated than that. But the good news is we know what we need to do to correct that, so that as gravity pushes down on you and as you continue to age, those discs are just going to get closer and closer together. They're going to severely affect the nerves, and your quality of life, not just pain, but in your visceral organs. So by corrective care, we're adjusting and we're using these additional therapies to replace those curves where they need to be. Otherwise, I mean, if our spine doesn't have the right curves, the gravity force is much greater and the degeneration is going to accelerate much greater.
I can't afford to get any shorter. Okay. This is it. If you're telling me that the spacing, the gravity is going to, how much shorter can I get? It's like, I worry about that. Okay.
He's cracking me up.
So, time is, we're out of time,
Sorry.
but I'm going to put on the screen all her contact information. I guess people can call
Yes,
and
please call.
find out what they need to do, come in for consultation.
Yes, definitely.
Okay, and with that, everybody will be right back.
Thank you.